Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the SI joint. It is the Fortin Finger Test. This test was developed by Dr. Joseph Fortin and was described in a paper in 1997 on the description of how to perform the test. However, he does reference this test in a paper in 1997, and if you look at the citations, he references the paper that was published later, saying it has been put forth for publication. So he came up with this test as a way to diagnose SI joint dysfunction. And the test is very simple to do. All you do is say like, hey, where are you feeling your pain? The patient reaches back and points to an area of pain. Now there is another discussion of how to perform this test, is that you ask the person to point to where the pain is. You go about doing some stuff for like 5-10 minutes, and then you ask them to point to the area again to say, where do you have your pain? And if they point to within 1 centimeter of that original area, then it's positive for an SI joint dysfunction, or the test is positive. Now we'll say, I could not find any articles, papers, or anything like that to talk about things like the sensitivity, specificity, the reliability of this test. It was referenced in another paper in which they utilized it to try to determine if there was an SI joint dysfunction or a facet joint dysfunction, and they also utilized injections in that paper to confirm it, and they said that, well, just on theirs, that it was a way to kind of figure out if the pain is coming from that, but they said the diagnostic reliability of it was pretty low, or diagnosis accuracy was pretty low. And like I said, overall, I can't really find anything about it. And in some of the articles, which have been put forth by Dr. Joseph Fortin himself, he's put out a lot of information, and he utilizes his test over and over and over again. It overall looks like it's kind of best used in a cluster, that somebody says, hey, where's your pain? They point to that area, and you maybe utilize other things, other tests and stuff, along with your assessment and patient history to get a better idea about it. So there you go. That's the Fortin Finger Test. What do you think about it? Do you utilize this test? Do you utilize it in your assessment or anything like that? Do you think we need to do a little bit more research and see how good this test is overall? Well, with that being said, as Mateo always says, take care of yourself, take care of your patients. We'll see you next time.